This call is now being recorded.
So today I will be starting with new chapter. The topic is benign non-odontogenic tumors of the oral cavity. You see there are different categories of tumors that are there in Schaeffer's textbook. This is the first. This is one category. One category where you can see the tumors are benign, non-odontogenic. I will discuss later why I have used this term, non-odontogenic tumors of the oral cavity, and what are the different types of tumors that are mainly occur in the head and neck region. We are only concerned with those tumors. Most of these tumors can be seen elsewhere in the body. They can be seen throughout the body, but our main concern will be only on the tumors that are occurring in the head and neck region, which are very important for us. So before going into the benign non-odontogenic epithelial or connective tissue tumors, so I would like to discuss some points about the differences between a benign and a malignant tumor. So if you know those differences, then you can clearly understand what actually are these tumors are. So can anyone tell what are benign tumors and what are malignant tumors? What do you understand by this term, benign or malignant? You might have read in your second year pathology, general pathology. These terms are, I think you are familiar with these terms. Can anyone answer?
Benign, not harmful, sir.
Benign is
Not painful and much harmful than malignant.
okay. Any other things? Any other things? Any other points you want to tell?
For shorter duration.
Benign is confined to some place, sir.
Yes.
Whereas malignant, it has metastasis spreads.
Yes.
It's generalized.
Yeah, you have used the term metastasis. Good. Any other differences between benign and malignant?
Invasion, sir.
Well differentiated.
And Sudhir?
Invasion, sir. Invasion.
Yes, invasion. Invasion ఉంటుంది. Good. Malignant tumors ki invasion. Invasion. Right. Any other things? Any other points you want to add?
Anaplasia, sir.
Anaplasia, very good point. Anaplasia is a good word to use. That is seen in the malignant tumors. Any other words? Any other points you want to add? So basically, metastasis. Yes, I think already someone told it. Metastasis, that is, it can invade. So coming to the differences, basically you see in layman's terms, benign and malignant ante enti. Benign means non-cancers. Malignant is cancers. So in layman's terms, if we are telling a patient he has a tumor, he has a growth, he has a swelling in the oral cavity, head and neck region, he comes to a dentist or any medical specialist. So whenever we give a diagnosis, he doesn't want the full diagnosis or microscopic diagnosis or what you are doing. Only the patient will ask you whether it is a cancer or a non-cancer. Patient will ask you only that word. Is it cancer or kada? So in that terms, if you say benign is non-cancerous, malignant is cancerous. Why the term cancer is being used? Because when you say it is cancerous, the total procedure, treatment procedure differs. And also it is more apprehensive for the patient also. When you say non-cancer, patient also feels little better and the total treatment modality also changes. So that is the basic difference in the layman's terms. But coming to the actual differences, benign tumors, if you see, these are generalized points which I am telling. There may be some differences again here. It is not always true. But mostly, if you see the benign tumors, they are slow growing tumors. They grow very slowly. They don't have the invasive properties. They don't invade the adjacent tissue.